Hi, student. This lecture about management of patient with acute coronary syndrome, myocardial infarction, chapter 27. So this lecture will be recorded. Previously, we speak about atherosclerosis and angina. So in this lecture, we will continue, about myocardial infarction. So they are similar. So first, we'll start with the acute coronary syndrome. Acute coronary syndrome is an emergent situation characterized by an acute onset of myocardial ischemia that result in myocardial death. So previously we speak that about atherosclerosis, and we speak about angina, and we said angina may be developed to the myocardial infarction. So normally acute coronary syndrome include unstable angina, and we speak before that unstable angina may develop to the myocardial infarction. And also so what you have to know that term acute coronary syndrome could be referred to unstable angina or myocardial infarction or heart attack. So what happened in the unstable angina? In unstable angina, so there is reduced blood flow to the coronary artery, often due to the rupture of the atherosclerotic occlusion, and may result in myocardial infarction if there is no immediate intervention. So what previously we speak about angina, and we said the different type of angina. We said we have stable angina and stable angina. So unstable angina, there will be reduce of the blood flow, and this reduce of the blood flow may there will be rupture of the atherosclerotic plaque, and this will lead to develop of the myocardial infarction. So in this case, you will have an area of the myocardium is permanently destroyed. So in this case, you will develop, the patient will develop myocardial infarction. So what you have to understand that unstable angina could lead to development of the myocardial infarction. So another things, you have to know about the causes and pathophysiology of the myocardial infarction. We said the causes of the angina or unstable angina or myocardial infarction is, reduce of the coronary blood flow. But there is other causes, reduce of the coronary blood flow because of the atherosclerotic. But there is another causes like vasospasm. So there is sometimes the patient will have vasospasm and sudden, construction or narrowing of the coronary blood vessels. And also the other causes of the myocardial infarction may be because of decreased oxygen supply. So decrease of the oxygen supply will lead to the acute how the patient will have decreased oxygen supply. For example, if we have acute blood loss, anemia, or low blood pressure. Another things is increased oxygen demand, such as, for example, other causes could lead to the increase of the oxygen demand. It is rapid heart rate or thyroid toxicity, because all of these cases, if we have increased oxygen demand, or we have decreased oxygen demand, or we have vasospasm, all of these will lead to reduce the oxygen supply to the myocardial infarction. So because of that, there will be imbalance between oxygen demand and supply. And already we explained before that there will be increase in the demand of the oxygen, and there will be reduce in the supply of the oxygen. So, we'll continue about the causes and pathophysiology. You have to know that infarction develop minutes to hours, and cardiac cell deprive of the oxygen result in ischemia. So when there is no oxygen, there will result in ischemia and, cellular injury. And prolonged oxygen deficiency can causes infarction or death, or what we call myocardial infarction. So you have to understand that we have different type of the myocardial infarction. What are these type? We have different type, like anterior, posterior, lateral, or inferior. So based in the location of the location of the injury in the ventricle wall. And we have also non-ST elevation MI or ST elevation MI, and all of these and we have also sometimes acute or old infarction. And all of these it is very important to know the type of the myocardial infarction can be identified by the ECG. For example, echo, we cannot use it to identify to identify myocardial infarction, the type of the myocardial infarction, but we can use ECG to identify, the type of the myocardial infarction. So it's very important to understand the clinical manifestation of the myocardial infarction. So when you are able to understand the clinical manifestation, you will be able also to provide accurate management. So for example, the patient with the myocardial infarction will have chest pain, and this chest pain will be suddenly and continue despite the rest or medication. Previously we explained that patient in stable angina will have a pain, that pain will be subsided by rest or by the medication. But here in myocardial infarction, if patient have unstable angina and develop to myocardial infarction, the pain will be suddenly and will continue despite the rest or medication. And also the patient may will have murmur S3 or S4, and may will have regular vein distension, and may the patient also will have increased blood pressure, irregular pulse or tachycardia or tachypnea. And also all of these may be because myocardial infarction could lead to the dysarrhythmia, and dysarrhythmia could increase, cause irregular pulse or tachycardia, or sometimes myocardial infarction could lead to the heart failures, and this may develop, a patient will develop, increased blood pressures, or also blood pressure could be increased because of the anxiety, and also the patient may because of the blood heart failure, also the patient may will have jugular vein distension. So some signs of the angina is sometimes also patient may will have nausea and vomiting, or fear or anxiety and short of breath, and this is common sign and symptoms. You will see the patient nauseated and vomiting, and you will see the patient have anxiety and fear because of the pain, and he is unable, he has sudden chest pain, and he is unable to breathe, and he has restlessness, and all of these. Also, it's very important to know that patient could will be cool, and will have pale skin, and will be sweating, and another things will be decreased urine output. So these are some of the clinical manifestations that you have to know that patient could have with the myocardial infarction. So diagnostic assessment of the myocardial infarctions. When we go to the diagnostic assessment, we will start with the physical assessment. You have to take the physical assessment and history about the patient. For example, you have to ask the patient about the onset of the pain, and the time of the pain, and the duration, and all of these is very important to ask the patient, because it's very important to ask when the pain occurs, and when for how many long, and all of this is very important to take the history of this. And we have to take the serial ECGs. It's very important to put the patient in serial ECG for 10 minutes. You have to, because the patient, we have to repeat the serial ECG. For example, patient it was an emergency, you will see that patient they repeat the ECG 1 time, 2 time, 3 time to check if there is any changes in the in the ECG. Sometimes the patient will come to the emergency department with the without any ECG changes, but later after half an hour or 2 hours we have chest pain, but no ECG changes. But after 2 hours, 3 hours, the patient maybe develop some ECG changes. And it's very important to know that the ECG changes in patient with the myocardial infarction, it is T wave inversion and ST segment elevation and abnormal Q wave. So for example, this is the you have to know, for example, this is the normal ECG, but if you go here, you will have this is abnormal ECG. The patient have ST segment elevation. For example, here it is elevated, and he has inversion, inverted T wave. See, the T wave is inverted, is abnormal. So it's very important to understand when you ask you what the ECG changes in patient with the myocardial infarction. It is ST segment elevation and T wave inversion. So we'll continue about the diagnostic test. So it's very important to take some of the diagnostic tests. We said that ECG is very important diagnostic test, and also echocardiogram is one of the important diagnostic tests. It is, we use it to identify the the function of the heart, to identify the ejection fractions, and if the patient has heart failure or not. And laboratory test, and we already explained about echocardiogram before. So a laboratory test is very important also also the patient, when the patient will come to the emergency department, for example, with the chest pain, they will do some laboratory tests like, cardiac enzymes such as, creatine kinase, or, CKMB, or they may do myoglobin or troponin. But this is, you have to know that troponin is one of the important one, because it is identify if there is myocardial, damage within 3 hours. But the others, could be, the damage could be not related to the myocardial, could be related to the other, muscles in the body. Uh, Management of the myocardial infarctions. Also you have to know that the patient will be transferred to the emergency department, and so for example, the patient, they will do 12 ECG lead, and they will continue doing ECG within 10 minutes, and assess for the troponin test immediately, and complete the bed rest. It's very important to know this is, I explained this before, but it's very important to know that patient will be in the bed rest. So it's very we don't want patient to move. We want patient in bed rest, because if patient move or something, patient will have short of breath, patient will need oxygen demand will increase, and in this case the patient will have already the oxygen supply is reduced. We don't want to increase the oxygen demand.